Hello, everyone, and welcome. This week we are going to start talking about trauma treatment. So, in part one, we are going to start by a reminder of the three primary implications of trauma. The first is that the mind and body are stuck in a perpetual state of threat. The second is that the brain is unable to filter that information temporally or contextually. And third, this results in an impaired sense of self and disconnection from the body. So those are the three items that we're mainly focused on healing as we move into talking about the treatment of trauma. So it is important to talk about how sometimes when we experience a traumatic event, and then we have intrusive symptoms after that, there are a couple of things that can happen. The first is flooding, and then the second is avoidance. Now, flooding is when you have an intrusive thought, flashback, nightmare, or any other sort of event, and your system becomes overwhelmed with the emotions that it is experiencing, particularly fear. And then, of course, another way that we can respond to that is avoidance. And avoidance occurs when we not only just avoid stimuli that we have learned may trigger the flashback or intrusive thought, but also avoidance of situations, avoidance of anything that could potentially trigger the client. And so that can cause, both of these reactions can cause pretty significant impairment in your life and in the way that you function on a day-to-day basis. So it's important that as we talk about treatment, that you're able to talk about these reactions to clients so that they can kind of figure out if they tend to go towards one or the other, or if they're experiencing both. So we are going to start with the basics today, and the three conditions for effective trauma treatment: safety, agency, and integration. So safety, of course, in the counseling space can refer to physical space, but it also refers to emotional space. Using your basic counseling skills of unconditional positive regard, empathy, compassion, all create that sense of safety. Agency is something that many people lose when they have gone through a trauma. And that is the feeling that you can control some of the things in your life, that you believe that you can complete tasks, that you can handle situations, and that you are mostly in control of your reaction to events around you. And trauma can steal that from us in many ways. Our brain starts reacting instead, or at least our lower part of our brain starts reacting instead of our prefrontal cortex or other parts of our brain that help us feel like we are more in control. And then lastly, integration. So this comes from really exploring the trauma symptoms, and working towards reducing those symptoms and integrating the trauma as part of a meaning-making process in one's life. So here is some information on the foundations. Just some basic understandings that you want to have as you move towards trauma treatment. The first is that as human beings, we like to talk about things. We like to process, sometimes internally, sometimes externally. And humans intrinsically do a processing of trauma. Of course, sometimes depending on the trauma, we get stuck, which is when we need help. But there is an innate desire or need to process. Second, core conditions, like I mentioned earlier: be respectful, use that positive regard, empathy. Make sure that you repeatedly validate your client for the bravery and courage that is involved in seeking assistance to help them get out of these disruptful patterns that they, of course, did not choose. Their body was trying to take care of themselves, make sure they survive. And now it just can't get out of that space. And so you are there to help them with that. But it does take a lot of courage, particularly when we start talking about stigma and this idea that you should just be able to tough it out or get over it or move on, none of which your brain cares about. Your brain doesn't care about cultural values around stigma. If it's stuck in a traumatized state, it's stuck. And so it needs some assistance getting out. But nonetheless, it takes courage to seek assistance for that in many settings where therapy is seen as something that only, people do if they're a certain demographic or, etc. So I'll just say cultural norms. Next, assess. We spent a whole week talking about assessment. Assessment is continual. You won't ever stop assessing. There's no way to know if a treatment is working or not if you aren't assessing symptomology, how strong the symptoms are, how often they're happening, if what you are working on is making things worse or better so that you can adjust your treatment plan. Next, establish hope. We talked about this before too. Make sure you honor the pain that this has caused in your clients' lives, but also instill hope for change. Our brain tells us that it can change. That's what neuroplasticity is. And that can be a very powerful message for a client who has felt stuck for a long time. At the same time, don't make any promises. Please don't say things like everything will be okay or everything happens for a reason. Those sorts of statements can diminish pain and leave a client feeling unvalidated by the one person that really should be validating them every chance you get. So something to remember, don't make promises, but do instill hope. Another really good idea as far as foundations go is exploring the pain paradox with the client, which is in your readings, and they talk about that in The Body Keeps the Score as well. Is the client participating in actions that are self-sabotaging? It could be re-traumatizing behaviors or putting themselves in high-risk situations. As you listen to the client talk about the way they are currently living their life, this could be something that you could assess. Next, establish safety, which we've talked about, establish stability. For many clients, this is going to mean needing to know that they can have the same appointment time with you, the same day of the week, notifying them well in advance if you're going to take a vacation or be out on leave. It also means if you foresee yourself changing jobs in the near future or going out on any sort of extended leave, that you don't take new trauma-based clients, because that safety and stability is something that is a high need in clients who are working through their trauma. Build a strong therapeutic alliance. You really need that vulnerability and trust. Otherwise, this isn't going to work. But also remember that everyone is unique and will be working through things on their own timeline. And so manage your expectations around how quickly you think someone should get better, and help your client understand that every person follows their own timeline, which is often more related to the brain and how it's working and how ready or willing they are to engage in some of the therapies that we use for trauma treatment. And last, but of course not least, no one size fits all. So even if you do become a trauma-based therapist and that's your specialty, and you get trained in EMDR, that is not going to be the one treatment that fixes every client. There is no protocol that across the board will stand up again and again as far as this is the best treatment for all clients who have trauma. So it's important to be well versed in multiple techniques, multiple interventions, so that you can decide through getting to know the client and their presenting symptoms what the best treatment will be. All right. So there are 4 concrete steps for working with trauma. We're going to talk about the first 2 this week and then the last 2 next week, because each of these steps have many sub-steps and different things for us to learn about within them. So we're going to start with 1 and 2, self-regulation and helping your clients towards self-empowerment. And then next week, we'll talk more about helping clients learn to express their inner experience and integrating senses through rhythm. All right, so to dive in here in step 1, self-regulation. I'm curious if you all have heard of regulation, emotional regulation, affect regulation, and what your thoughts are on it. So take a moment and think about that. I think it's important that we talk about emotion regulation because it's tied to so many different aspects of our mental health. So even outside of trauma, One of the things that comes up when I talk to practitioners is that whether they're treating kids or adults or older adults, they often present with issues related to emotions. And that could be something as simple as not knowing like what emotions are or what they're called, or how to name a feeling that they're having. It could be something more along the lines of stigma related to talking about feelings and emotions. It could be masculine stereotypes. It could be other cultural values. But I hear again and again that foundation of clients like knowing how to talk about their feelings is lacking many times. And so that's a place that we start with lots of clients, like how do we talk about our feelings? How do we name and recognize them? What you have to be able to do if you want to be able to regulate your feelings. So even before we talk about regulation, we may have to have a step 0 that talks about how to name and identify your feelings. And that's where that feelings chart will come in, worksheets and other things you may have your clients do on recognizing and naming their emotions. Because if you don't know what you're experiencing or what to call that feeling, then it's very difficult to then try to regulate it. So first, explore the unknown, and then move into regulating both the distress reduction and affect regulation. So one of the ways that we can work on reducing stress, reducing the distress, and regulating our emotions is grounding. And this may be a term that you have heard before. It is used, I think, in shared language outside of mental health professionals. But in case you haven't, or if you aren't sure what it actually means, because like a lot of mental health terms, it gets kind of bandied about like it doesn't have any real meaning, but it does. These are foundational activities that help the client feel safe and help them stay or return to the present. And they are really helpful for clients both in session and out of session when they may feel themselves slipping into dissociation, when they cannot regulate their emotions, or they feel unsafe. So we know that many people who are traumatized often aren't, when they're in that state of fight or flight or freeze, their body is saying that they aren't safe. But many times, especially when you're in counseling, in some other part of your brain that you are safe. And so a grounding exercise helps the client return to the present moment and focus on it. Many of these activities focus on senses, so sights, sounds, touch, taste, things like that, because those are very visceral, present moment experiences, and there are lots and lots of options for you. So I listed a few here, but there are 2 handouts on Canvas. One is in your required reading and one is in your extra resources for more ideas for grounding. And this is really important, I think, because not every grounding activity is going to work for every client. So offering them sort of this many choices of the different activities will help them find something that works best for them. So one thing you can do is just ask the client, tell me what you see, hear, feel, smell, and taste. And some people will do this as a countdown. So they'll say, tell me, 5 things you see, 4 things you hear, 3 things you feel, 2 things you smell, and 1 thing you taste. So that the client really does have to focus on the present to be able to name the number of things. And it can often bring somebody back into the present moment when they are activated. Another thing you can do is ask the client to narrate what's happening in their mind. So especially if you notice that they have checked out or dissociated, tell me what was happening in your mind. That's a good way to get them back re-engaged in the present with you. Always remind the client that they are safe in the counseling space, that they are present, that they are not in the time or space where they were harmed. That can be helpful, as well as guided breathing, relaxation techniques, monitoring your heart rate. This is something that you can get free apps on your phone to do. And sometimes I will have clients measure this both before we do an activity and after, so they can see the difference that it makes. And especially for children, they're always just amazed. They think you're a wizard because you predicted that their heart rate would go down after the technique. And then, of course, you want to assess for readiness to return to whatever you were talking about that that caused the client to dissociate or have some emotional dysregulation, such as flooding. And this can be done through just asking the client, do you feel like you are ready to return to what we were talking about, or do you think you need more time? You could also ask if maybe they need some water or something else, or any sort of transition back into the session could be helpful. So again, check out those extra resources in Canvas. All right, next we're going to talk about just stress reduction and affect regulation through a couple of other techniques. The first I mentioned before, relaxation and breath control. We know through multiple studies that we can control our heart rate through very specific ways of breathing. And I've given you a couple of examples here. And so you can do the count of 5, breathe in through your nose, blow out through your mouth for a count of 5. And you want to repeat this at least 8 times because it will take time for the heart rate to slow down. You can also do a longer breathing out of the mouth, so maybe like a count of 8 to 10, if the client can do that, or even building up to a slower breathing out, I think is helpful. You can also do progressive muscle relaxation. Some of you may have already been trained in this. I can try to find a script for it, but it's pretty standard use in a lot of relaxation activities where you just kind of go through your muscles and squeeze them and then release them to where you're relieving all of the tension in your body. You could do a mindfulness-based breath training, which I will also give you a resource for. And that can be, I think, especially for people who are open to mindfulness activities, that can be very helpful. Next, meditation and yoga, also other things that can help reduce distress and also help us regulate our emotions. I really like guided meditations. I'm not a particular fan of open meditation, though some people love that. And so the point of whether it's an open or guided meditation is identifying your thoughts and feelings, but learning to not judge them. And through this to reduce the client's occupation with negative thoughts. So everything is okay. It's not bad. It's not good. It just is. And so the point of meditation is learning to accept and kind of let things pass through you. And that can be pretty helpful for a lot of clients, especially in thinking about, how do I manage this, or how do I got feeling very reactive. Should I send this email right now? Maybe not. Maybe I should just do a short meditation and breathe and move through it. So there are a lot of meditation apps. The Stop, Breathe, and Think app is one that I've used before that is free. I also have a subscription to the Calm app, and they typically offer a discount for mental health practitioners. So that's something to look into. If you like that app, they also offer, typically around like Black Friday, they'll offer a lifetime membership fee that's pretty reasonable if you look at how much it costs anyway to get it year to year. So, and there are lots and lots of others. So these are just some that I know about. If there are others that you like or that you want to recommend, please drop a comment in our open discussion board for your peers. And then I also want to mention Yin Yoga, which if you haven't heard of that before, Yin Yoga is a much slower version of yoga that's focused on joints and stretching the ligaments. It can be very relaxing. It's typically a slow-paced class where you will stay in the poses for 2 to 4 minutes. And it can be incredibly mindful and therapeutic to do if a person enjoys body work. And it's also, I think, a good introduction to body work because it is fairly innocuous, no one has to touch you. You can do it to your extent. Most instructors that do yin yoga will tell you just do what you're comfortable with, don't push yourself. And there are also some good free videos on YouTube for that. So those are some options. And then when we're thinking about affect regulation, it's important, especially if someone doesn't have foundational tools from their youth for affect regulation, for us to work on that, to build up your capacity for high emotional states. And so you can think of this as strength training for your emotions, but essentially what you would do with the client's consent and knowledge and some good grounding and breathing activities on the side for when you need it is have them talk about emotional experiences. Start with things in the past that are maybe not as reactive or that they've processed. Help them identify and name emotions and then link those to their behaviors or actions or events that happen. Part of this can also be identifying and countering those intrusive thoughts. These could be core beliefs. They could also just be beliefs related to the trauma or trauma events. And then as you're doing this work, you're identifying triggers. And so the client can make a plan to address those other than avoidance, right? Because avoidance often gets us into a place where it's even harder to move forward. We've avoided for so long that the big thing is even bigger and the scary thing is even scarier. And so to kind of tear down those walls, it's helpful to take one step at a time, make a plan, what your triggers are, use adaptive strategies such as grounding and breathing exercises to help the client start moving forward through their avoidance. And really, it all starts with knowing how to talk about feelings and being comfortable with that. And so that's why we talk about that so much and kind of ad nauseum in the counseling program, because if you can't talk about and identify feelings, you're going to get stuck in a lot of the work that folks need to do in their sessions. All right, so let's try a relaxation technique together. This is a short loving kindness meditation, which I have linked in the PowerPoint, but also in Canvas for you. So I'm going to end this video here. I would like for you to try this loving kindness meditation and then come back to the second part of the lecture whenever you're ready. So it could be right after that. It could be take an hour break or a 20-minute break and stretch and get some water, and then we will pick back up where we left off.